In this video, you're going to see the removal of an upper and lower wisdom tooth on the right hand side, but you're also going to see why we removed it and then the risk assessment before removing it. So this patient actually came in 2 weeks prior to this day to have her upper left wisdom tooth removed because it was causing her pain. We ended up deciding to remove her lower left one as well because it was very dirty and it was hard for her to keep clean. When we made an assessment of the right hand side ones, we decided to remove them too because they were looking like they were going to face a similar fate. So if I show you some photos of those teeth, you'll see that the lower right wisdom tooth, it's got plaque around it. There's already some spots that look like it's about to form decay. There's some bleeding. It's a hard tooth to keep clean. With that being the case, it can eventually cause problems with the tooth in front or with itself. She can end up in pain. Is it worth keeping it? Not really. If we look at the one at the top, it already has a hole in it. There's a hole that's formed on the inside of the mouth. Then the top surface, it was very close to forming a hole. Again, it's hard to keep clean, could cause problems to the tooth in front of it. Not worth keeping it, let's just get rid of them. So when we make a risk assessment, we look at the X-ray. And the nice thing about this X-ray, or the nice thing about these roots, is that they're actually formed a cone shape. So I've outlined the roots here and you can see that pretty much they've actually formed a bit of a cone and they fuse together. That means when I remove them, they're not going in different directions. It's going to be easier for me to remove. The next thing that we look at is the nerve that supplies touch to the lower part of your face. And that nerve runs along the inside of the jaw, and sometimes wisdom teeth can be quite close to that. Now I've got here in yellow outline where that nerve is, and we can see that it's quite close. But if we go back to the original image, however, I know that it's close, but the fact that I can actually see the outline of the roots of that wisdom tooth on the X-ray tells me they're close, but not close enough for it to be a big risk of nerve damage. The next thing that we look at is the sinus, and you can see that here marked by the pink. Again, I'm quite close to it, but not close enough that I'm concerned that it's going to be a big problem. So this is a low risk procedure. All right, now let's get into the procedure.
So after the patient's numb, before we get started, I'll just check that they can't feel any pain. So I'll go around and feel with the probe. This is the top tooth. Then we'll do the same thing on the bottom tooth, inside and outside. Now we're going to start on the top tooth first. And to make my life easier, I get them to close to halfway and move their jaw over to the side that we're working on. That'll give me the access that I need to get to the tooth. Now, the first thing that I'm doing is I'm using my luxator. This is an instrument that basically it's used in kind of like a levering sort of motion. And I'm basically driving it down in between the tooth, so the wisdom tooth and the bone, and I'm levering and twisting at the same time. Now, you can see that the tooth is moving a little bit. Often this is the case with upper wisdom teeth. They do come out relatively easily in a lot of cases. So we're just keeping some pressure, and that pressure is what's going to stretch the fibers that's holding this tooth in place, and that's what's going to get this tooth out. So I'll do as much as I can with my small luxator, then I'll switch over to my large luxator, and I'll do the same sort of thing. So I'll drive it in between the tooth and the bone, and it's just this twisting movement. And you can see the tooth, it's moving back quite a lot now, so I know that if I continue this, I'll most likely be able to get the tooth out. A lot of the times I can do it with just a luxator, but this one just really did not want to come out. I kept filming here just so you can see how far the tooth was pretty much out of the socket, but it just wasn't wanting to come out. So I ended up grabbing onto it with some forceps. So I didn't have to do very much once the forceps were on. It was just a little bit of a movement to the right, a little bit of a movement to the left. Then eventually it got to a point where it just popped out. And this is the tooth here. So you can see it's got spots on it, had decay on the surface. It was just a crappy tooth. That's why we were taking it out. So we do a rinse with chlorhexidine, then we move on to the bottom one. And it's the same sort of story. I'm using my luxator in a similar sort of fashion. I try it first on the front of the tooth. That's my go-to place, but it wasn't really moving. So I found actually with this one, most of the movement was coming from the outside of the tooth. And I'm going in between the outside surface of the tooth and the bone, and I'm just twisting and twisting. And you can see the tooth's moving quite a lot. Because it was moving quite a lot, but it wasn't really coming, then I thought, well, maybe I'll switch to the front of the tooth, try that. It wasn't really giving me a huge amount of success, so then I switched over again to my larger luxator. Same sort of story. We go to the larger one, you can get a little bit more movement. Started on the front, then I moved to the side, and this is the point where I actually was successful in the end with it. So found that spot. You find the spot where it's moving, you keep some pressure, you take it off, you keep some pressure, you take it off, and the movement gets bigger each time. The reason that I go to the front is just to add in like an additional movement. So if it is finding that it's difficult to go out on that certain path, if you bring some pressure from the front, then that change of pathway can help it come out. And you can see here the tooth's pretty much out. The only thing really that's holding it on now is the soft tissue, so the gum. And it's the gum on the inside of the tooth, so on the tongue side, that is holding it. And These are often really tricky to get out because you have nothing to really grab onto, and I'm trying to lever it and it wouldn't really come out. So I then use my tweezers to grab it, and you've got to be really careful that it doesn't slip out, which it did in this case, but I was ready. And then these are the 2 teeth that are out. This one also had decay on it, so it was just a crap tooth too. Then we rinse with chlorhexidine there just to help with the healing. Put some chlorhexidine on some gauze, put that into place, get the patient to bite together, and we are done.
So there you have it. I hope you enjoyed the video. If you did, please like, share, subscribe. It helps me out a lot. If you've got wisdom teeth extractions coming up, good luck for them. I'm sure that you'll be fine. Keep up your pain relief. That's a big savior. And I hope this video didn't put you off too much and it made it seem like it's not as bad as what you might be thinking. If you have any questions, put them in the comments section. I'll make sure to get back to them. Have a great day and keep on smiling.